growth. We're Care. We are a home-based primary care services provider. And this is Kate Hernandez.
I'm Kate Hernandez. I've spoken here before, some of you I've met. I own Therapy in Motion, which is a mobile physical therapy and occupational therapy practice. So we're like an outpatient clinic that comes to your house, and we'll talk about that more.
Yeah. So who here has straight Medicare versus an Advantage plan? Straight? Okay, and the rest of you have Medicare Advantage plans?
We have both, regular Medicare,
Yeah,
I'm sorry?
just the regular Medicare.
Yeah.
Yes, that's what I'm talking about when I say straight Medicare, as opposed to a managed Medicare through
Yeah,
like United
right.
Healthcare or Aetna or Blue Cross.
A lot of the federal employees in this area do not have Part B.
right,
They
Okay.
have their FEHB
right.
plans.
Because
Yep.
through the Med Advantage.
It's not Medicare
No,
Advantage.
It's
totally
just for
separate.
federal employees, yeah.
Okay.
So
So,
I have Medicare Part B as my primary, and then my husband's a state of Maryland employee, and I have United Healthcare as a secondary.
okay.
Is
So,
Kaiser considered, is Kaiser considered an Advantage plan?
it can be, I mean, there are some people that have straight Kaiser insurance and some have a managed Medicare through Kaiser. Kaiser's very strict though, they want you, they're trying to draw you to their centers, and it can work very effectively for some people. Like if you can go and have your internal medicine appointment and then dermatology and maybe a gynecology appointment, they're tracking you, like you go boom, 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 through their center. If, you are out of that loop and you need a specialist that maybe doesn't accept Kaiser, it can be kind of problematic for from my little view of the world, when people call us and they need home-based medicine, we can't help them because Kaiser stopped paying us. So we no longer accept their insurance.
And how about United?
No, we're in network with United.
Oh, okay.
So we're just, first of all, I wanna give you the CMS website. It's www.cms.gov. So that's the Centers for Medicaid and Medicare. It's a lot of information, probably more information than you ever wanted to know about Medicare. But it covers Part A, Part B, Part C, Part D.
Would you repeat that?
The-
The website?
Yep, www.
Is that not on here somewhere?
No,
It's not.
.cms, C is in Charlie, M is in Michael, S is in Sam, .gov, G-O-V. You're welcome.
That's the safest, best place to get information on Medicare.
Okay.
If you just Google Medicare, you're gonna go to a bunch of people who think they're experts in Medicare and may not be, but that is the website.
Could you repeat that, please?
Yep, www. C is in Charlie, M is in Michael, S is in Sam, .gov, G-O-V.
CMS, okay.
Medicare sends out a booklet every year, Medicare and You.
Okay,
That has a lot of information.
Yep.
And as long as it comes from Medicare, then that's great.
so we're just gonna give you the general Medicare overview. Medicare includes Part A, which is hospital insurance, Part B, which is medical insurance, so preventative and maintenance care. Medicare C are your Medicare Advantage plans. A lot of times they will also include dental and vision. You can join a separate Medicare drug plan, coverage Part D. We're not gonna talk about that at all because that is a whole other entity, and that's not something that we deal with on a daily basis in either of our organizations. You can use any doctor or hospital that accepts Medicare anywhere in the United States. To help your out-of-pocket costs, original Medicare, for original Medicare, you have your 20% co-insurance. You can also shop for supplemental coverage, such as AARP or Mutual of Omaha as a supplemental, so.
Or Blue Cross Blue Shield as well.
Yeah, there's a bazillion supplemental
Yeah.
plans that will offset the costs associated in this 20% that the patient is responsible for. Who's eligible for Medicare Part A, when you turn 65, Most people are eligible when they turn 65. If they have a chronic condition at a younger age, some patients are also eligible for Part A, which is your hospitalization, your skilled nursing facility, your acute rehab. Anything you want to add to that?
Hospice?
Hospice, yep. To be eligible for Part A, you or your spouse must have worked and paid Social Security taxes for at least 10 years or 40 quarters. If you've worked and paid Medicare taxes for at least 10 years, you don't pay a premium for Part A. Eligibility for Medicare Part B is optional. You have to opt in for that. A lot of patients will call us and we run their insurance and they do have Part A, but they haven't opted in for Part B. So any maintenance, any outpatient services, any primary care is not going to be covered. 65 and older, you must no longer be working to get Part B services. You have to be a U.S. citizen or legal resident, and usually you have to be enrolled in Medicare Part A. You need to sign up for Medicare Part B coverage. The initial enrollment period is a 7-month period that begins 3 months before a patient turns 65. Do you want me to repeat that? I know that's very confusing. It's a 7-month window. So here's your 65th birthday. It begins 3 months before here. We don't make the rules.
Why did they do that? I mean,
Why does the
So
government
confusing.
do half the stuff it does?
Yeah.
There's a loaded question right there. I don't know. And okay, so 3 months before the month a person turns 65, their birthday month and ends 3 months after the person turns 65.
So you basically have a 10-month window.
Yes. Then, on a yearly basis, it's a general enrollment period that usually runs January 1 through March 31st of each year. So like if you wanted to switch from an Advantage plan back to straight Medicare, you have that window. Coverage begins the month following the month you sign up. So there is a little bit of a waiting period, enrollment period. Okay.
My turn. Yes.
Oh, I had a question. Premiums increase if you don't sign up right away, correct?
For,
Part B.
B. I believe so. Like if you miss your window,
Yes.
yeah, I believe so. They get you.
Okay, now, if you sign up for an Advantage plan, which includes Part A and Part B, will those premiums change depending upon when you sign up?
Advantage
it's
is,
specific to the plan.
yeah.
Because you have like a private entity kind of managing that plan, and they're gonna have some leeway in making their own rules. So when someone calls you and says, we've got this great product, we want you to sign up for it, we're gonna give you a free trip, we're gonna, all these things. Make sure you're asking the right questions about the premiums, about the complete coverage, about what happens if you have a doctor that you need to see. Let's say you have a terrible diagnosis and you need to see a specialist. You wanna find out what the out-of-network costs are, if you're allowed to see that doctor at all. There's a lot of questions, like they're gonna be selling you the sun, moon, and stars in these Advantage plans. Just do yourself a favor and make sure you're asking the right questions to advocate for yourself.
Don't just say sure on the phone. Make sure that you are talking that over with somebody that you trust and love before you make that switch.
Because the premiums might look good, but look
But
at
the
the
coverage
coverage.
is bad, yeah.
One of the reasons I signed up for United was because of the $300 per month cost for the regular Medicare. Was that smart or not?
It depends on your doctors
Depends on
and your
the
plan.
doctors, the
and-
coverage, the plan. And I'm sorry we're not able to give you really specific answers. With the Med Advantage plans, you really have to read the fine print and understand the nuances of the plan.
Way beyond our expertise.
Yeah.
Who can I talk to about?
You can call your
that?
plan.
Pardon?
You can call your plan.
Okay.
There should be a number on the back of your card that says Member Services,
Mhm.
and ask your questions.
Okay.
And then if you have specific Medicare questions as it pertains to your Advantage plan, go to the website that I provided.
So, what company are you with? What is your?
We both work for two different companies.
Uh-huh.
I work for a company, we provide home-based primary care services. Remember the little black doctor bag? That's us. And we bill to Medicare Part B.
So we're both Part B providers, and what we run into is many people don't understand the difference between Part A and Part B.
Yes.
And that's what we're focused on today, okay?
Yes.
Who can tell me? I'm gonna give you a type of care and I want you to tell me if it's A or B, okay? Inpatient hospital stay.
A.
Good job. Going to see your doctor. A, outpatient, right. Hospice. Oh my gosh, you guys are good.
Cardiologist.
B.
Very good. It's the middle row. You guys,
We're old now.
you guys got it.
We don't even know them, we just hired them.
Okay, now I'm gonna ask a hard one. And if you know this, then I'm just gonna leave, because then you don't need me. Home care.
B. B.
B.
It's B.
Wrong.
Really? What?
It's gonna really confuse you.
This is why I'm here. Mobile therapy.
A, I guess.
B.
Yes, it's B. So that's what I'm gonna focus on, is the difference. There are distinct differences between Part A, home therapy, otherwise known as home care, okay? That is one big name for the same thing. They're synonymous. Home care and, what'd I say? Home care and,
Therapy.
Mobile care.
Let me,
no, home health and home care. Those are the same thing used interchangeably. That is Part A, okay? Under Part A,
can I make I'm
Yes.
gonna just really confuse you now. There are two different types of home health, okay? You can get Medicare A, Part A, it's billed.
which we're about to talk about.
It's covered at 100%. It is called skilled care, meaning
Say that.
skilled, S-K-I-L-L-E-D. You get a skilled nurse, you get a.
I'm going into that. Hold on. Hold your horses.
Well, I'm getting the difference between assisted care.
No, don't. I would not go there.
Well,
I think that is, we'll go to that later.
All right.
Let's get through this first.
all right.
Okay, so Part A, inpatient, hospice. We just went through all of that. When people come to your house and they're covered under Part A, they are known as home health or home health care or home care, okay? Under home care, you can receive a skilled nurse, a PT, an OT, a speech therapist, a private duty aide, which we're not gonna cover at this second. We're gonna come back to that because it gets real confusing. And I think social worker.
Social work, yep.
So all of those services are covered under Part A, home care, home health, okay? There are certain requirements though, in order to qualify for this so that Medicare pays for it. You have to be homebound. Homebound means all the people in this room are not homebound. Homebound means you can only leave your house for religious services, hair appointments, doctor's appointments, okay? That's it.
Because they think, they consider that personal care. Again, makes no sense. But you can't go to like a birthday party at your daughter's house for your grandchild. Because if you can do that, you
What
can.
if your hair is already done?
You're not
We don't
homebound.
make the rules.
So it's very specific requirements to receive Part A, home care,
Yes.
home health, okay? You have to have a doctor's order or a referral that basically certifies that you are indeed homebound.
Yes.
Now let's say you tell your practitioner that you're homebound, and then the clinician gets out there and you say, oh, I went to the Maryland basketball game last night, it was great. Now they got a discharge, okay? So very, very specific requirements that these clinicians have to follow to be compliant with Medicare.
Yes.
Some companies that you've heard of that are home health / home care, Beata, Amedisys, Centerwell,
Phone call.
Home Call. Those are the big ones in this area. if you've heard of any of those, okay? That's part A. Who has questions about part A? Yes.
Okay, if you are being discharged from a hospital, does the hospital dictate what services you
That's a
get?
great
That's
question.
such a good question.
And we're gonna talk about that because part of the reason why we wanna do this is because I want you all to be informed for yourselves and loved ones who are coming out of a hospital, so you can advocate and know what is the best route for you to take. And we're gonna talk about that.
Have an awareness rather than a 5-minute window to make a very important decision.
Okay, ready? B. B covers mobile therapy. So we know that B covers outpatient services, right? When you go to a doctor's office. Think of a therapy provider that comes to your house under Part B. It's like we picked up the clinic and just brought it to you and set it down, okay? That is a Part B mobile provider, different than Part A. So I am a mobile provider. Therapy in Motion is a mobile therapy provider, covered under B. You do not have to be homebound. Any one of you would qualify for this, okay? The big difference between A and B as far as home services goes is that we cannot provide a nurse. That is an A service. So if you are somebody who needs a nurse, let's say you just got out of the hospital, you are medically complex, there's some diagnoses going on, you're having a hard time breathing, new oxygen, any wounds, any of those reasons, you need a nurse with you. So in that case, then a Part A referral would be perfect. But if you're being discharged from a hospital or you go see your doctor and they say, you need some therapy, and then let's say you say, well, I don't really like to drive, so can we get somebody to my house? The doctor would say, sure. And then what they should do is order somebody like me, because you're not homebound, let's say, okay? That's where mobile therapy comes in. You don't need a nurse, therefore you can have mobile therapy. Does that make sense? Yes.
Do you need an order?
Good question. Next on my list. No, you do not need an order from a doctor to see a mobile therapist. We have direct access in the state of Maryland, so we do not need a prescription or an order from a doctor. You can refer her, she can refer her, anyone can refer anyone. We just have to we have to know that you have a doctor that you have seen recently who will sign off on our plan of care, okay? So if you're somebody who hasn't been to the doctor in 5 years and this has happened, no doctor's gonna sign off on that plan, then we can't see you. So we always ask that in the intake process. Any questions? Yeah.
How does your fee, and you're one of many, I would assume, mobile therapists, how does your fee compared to the patient going to?
It's the same. So we take Medicare Part B, just like a clinic takes Medicare Part B. So it's all the same. It's no different. It's no different reimbursement wise for myself or for you if you go to a clinic or I come to you. It's the same. Now, there are some nuances with that, because if you have a secondary policy that requires the provider to be in network with, there might be a 20% co-insurance to you, which is typically around $25. We always verify benefits before we come see you, and we tell you what those are ahead of time, so you can choose to opt out and find an in-network secondary provider, okay?
So you are Therapy in Motion?
I am Therapy in Motion. Okay, Christine.
Can I
Oh.
No, I was just gonna say that I came to a presentation here and Kate was speaking, and I was having really some bad mobility issues. And so I called and I got her. Everything she said was true. I haven't paid a dime. And it was so nice because we would go out and like do the curbs, and which I really had a problem with because of my ankle, and on the grass level and everything. So you're getting I mean, it's like real life situations that you do,
Right.
and it was, and I was just amazed, it worked really well.
Thank you for that review, that
Thank
impromptu
you.
review. It's very beneficial, and Christine can speak to this too, for us to see patients on their turf,
Yeah.
in their home environment. That's typically where falls occur, as far as PTs, is 80% of falls occur inside the house. So I want to see you at the scene of the crime, so we can
Yeah.
really figure out why it happened and put it together. But go ahead.
And if you're noticing, like you're experiencing falls, a lot of people think, I don't wanna tell anyone because that's like kind of taking away my freedom. The goal is to let you age where you want to. And if you are experiencing maybe tripping, maybe you have a drop foot, these things happen. It's so important to get that help as it's occurring, because the chances of recovering and getting stronger right when you address it then, rather than letting it go 5 months, are far greater.
Mm-hmm.
And they can, Kate, companies like Kate can give you the exercises to do every day to keep you in really good shape. So with Medicare Part B, there is a deductible that you have to meet. And then for our services, so for home-based primary care, the biggest difference that we have is we don't have an office. We come to you wherever you live. It could be a senior living community, your home of 50 years, an assisted living. It's for patients that have chronic conditions that need to be managed, but they can't access community-based care. If people can access their community doctor and they've had a doctor for 20 years, I think that's a great thing. Those routines, that familiarity, that trust, it's huge. It's when you can't do that anymore that we come in. And we see patients every 4 to 6 weeks. We have no travel fees, no hidden fees. We bill the exact same way as a brick and mortar doctor's office. So depending on where you are with your Medicare Part B deductible, and then the copay. And then if you have whatever copay when you go to your doctor's office, it would be the same with us. So again, don't wait. Like if you're not seeing a doctor regularly, you should. It's just important to stay ahead of that potential exacerbation of something if you don't know that you have it. It's really good. So many things can be managed very effectively, long-term, and when you can't access community care, then they can be managed from the home.
So your company sends out MDs and PAs? And
We have PAs and nurse practitioners that generally do the daily care for patients.
Mhm.
Each one of them has their own unique territory, so you'd be seeing the same person over and over. They really know their patients very well. One of the greatest differences is in office-based practice, the amount of patients a doctor has is called a panel, like the patient panel. It can be anywhere from 500 to 1,000 patients, because they're seeing patients every 15 minutes. And you know this, you go and you sit and you wait, because no appointment actually takes 15 minutes. Like you're very fortunate if it takes that long. The max panel size for our providers is 150 to 200 patients. And the reason for that is our visit frequency, which is every 4 to 6 weeks, which is pretty different than office-based. And we have to account for travel times. Do you want to do the trivia?
No, we have more. Oh, wait, you know what, everybody, this is part of your packet, this chart. I've pretty much gone over all of it, but I just wanna quickly look at it real quick.
Yeah.
And also to your point, or to your question, the big thing is then, or the big question that patients have is, well, which one do I ask for? And really the provider should be the one that guides you to the right answer. However, that being said, I myself would never expect a patient to know which home-based service they need. So that's where, if I come out and I see you and I see a lot of red flags as far as medically goes, and I know you need a nurse, or let's say I find a wound that's gonna have to be dressed by a nurse, I'm gonna discharge you and refer you to a home health agency. So, and vice versa. We have great working relationships with the home care agencies. we refer back and forth to each other a lot. So it's, you know, no fear, we'll make sure you're in the right hands wherever you land. And what's nice about Christine and Enoble is so many times I have patients who cannot get out of their house because of steps or for whatever reason, nobody can drive in their house. And that is an easy, quick referral for me to get some sort of medical provider in the house for lab work and everything else, so that these people can just be monitored.
Yeah.
And you know, and then sometimes they end up staying with Enoble as their primary care doctor, and other times it's a short stint.
Yeah, so if you find yourself in an emergency situation, let's just say, I always use this example. Somebody has a stroke, okay, and they go to the hospital, and they're discharging home. Maybe they go to rehab and then home, but at some point they're discharging home. And let's just say they still have somewhat paralysis on one side, but they're anticipated to make a full recovery, which is the great news. They're concerned about getting out to their community doctor because maybe they're not driving and it's just very difficult. We don't have to meet the strict Medicare A home health criteria. Our patients have multiple conditions. Maybe they have difficulty with activities of daily living, so getting from the house to the car due to steps is just very stressful and very challenging, and maybe that fear of a fall is huge. So with us, if you find yourself in a situation where you're going home and you're concerned about getting back to your doctor, as long as your doctor never makes a home visit, we can see you. But here's the little but.
There's always a but.
If if your goal is to get back to Dr. Jones, we respect that. But work with us for 60 to 90 days, and there's a reason for that. In that time period, that'll be at least 2 or 3 visits for us. Remember, our visit frequency is every 4 to 6 weeks. So our services, coupled with other home-based services like home labs, home radiology, which we have access to all of these to send to you, one of 2 things will occur in this 60 to 90 day period. We will rehabilitate you back to Dr. Jones, which is what you want, and you say, I'm ready, I'm gonna re-engage with my community physician, please discharge me. Great. Or in that time period, you may come to realize this may be a better fit for where I am. I say this because we're not the one and done. We won't just come out and do one visit. It's a lot of work for our providers. They do research on patients before going to see them. We get as much clinical information as we can. It will do a patient no good to have us come out one time because we're managing conditions that need to be addressed. The reason we have this visit frequency is we have found that by engaging with patients more frequently, the hope is to get them engaged in managing their health care. We can get eyes on them and see some patients, let's just say a patient has COPD and their breathing has become very erratic and labored. And they just think that that's normal. It's not. There's so many things that can be done to help people in that situation, but they've come to like just in their mind think, my baseline is normal, I didn't think anything of it. We can make that intervention to head off that major exacerbation which would land them in the hospital. So the one visit just doesn't do patients any good. But the reason I say to work with us solely in this time period is one, if you're calling us for certain meds and Dr. Jones for others, puts you in a very dangerous situation. The pharmacy system doesn't catch everything. It is a catastrophe waiting to happen if you have 2 doctors doing the same thing offering 2 different plans of care. It's just not good. So, if you're not quite ready to say to Dr. Jones, discharge me, typically you have X amount of missed visits or a year between visits before they will say you're considered a new patient. Have you ever called a doctor, you haven't seen him in 3 years, and they're like, oh, we haven't seen you, and it's been 3 years, so you're considered a new patient, and new patient visits are out for 3 months, or worse, Dr. Jones isn't taking new patients anymore. So we don't want to put you in that situation. But 60 to 90 days is a reasonable amount of time to say, we can either make some great strides with this patient and get them back there, or for you to make an informed decision and decide what you wanna do. Yes?
I know I read somewhere that, there's gonna be a change where more people are gonna be in the hospital at home, but,
That's programs, yeah, that's a good question. It's different than primary care at the home.
okay.
It's hospital at home, where these hospital systems are creating, what they're trying to do is the hospital is the highest acuity patient, like the heart attack and, you know, the stroke that's emergent and needs like hourly monitoring. They're trying to transition patients away from that because it costs so much. So they have subacute rehabs, they have skilled nursing facilities, and they also have this hospital at home, where the health system has their practice that comes out and sees patients, you know, on maybe it would be a daily basis as opposed to having somebody there, you know, hourly and checking in on them. But that's, again, a temporary thing for an episode that a patient needs it. Does that make sense?
I guess it's just that it seems unnatural, I don't know. if you're-
I know, you think if you need hospitalization, you
Yeah.
just go to the hospital, but see what's happened is there's a lot of people that think a hangnail requires an emergency room.
Okay.
And so they're trying to manage care in the appropriate setting based on the patient's condition.
Okay. That explains it.
So with home hospital care.
That's something totally different, we don't do that, but go ahead.
Can we think of it as specialist versus your company being?
I really don't know, because I don't know if they created any
You're
of
asking
these.
about home hospital care?
Yes.
Okay, we don't do any of that.
And I don't even think the landscape is there yet, the
Okay.
hospital
Yeah.
at home program.
So. with
It's
your-
something that is potentially coming down the pipe.
With your company, is it more,
We're internal
So-
medicine.
is it similar to having a primary care?
It is having a primary care.
Okay.
Yeah, internal medicine. So,
But we still need our specialists.
yes, absolutely. So we can collaborate with them. Like, if you're going to a cardiologist, you're seeing them for a very specific reason. And we support that. And we think that you should continue with that because they know your heart better than anyone. But people also need primary care because, let's say you're a diabetic and you have a heart condition and the heart condition requires the specialist. You need somebody to manage the diabetes, to order your medications. You also need, if you need a flu shot, if you're not feeling well, just general overall, like, I don't know what's going on, I don't feel well. You need a primary care doctor, because if you call the cardiologist for that, they're gonna say, call your primary care. Does that answer your question? Okay,
Thank you.
you're welcome.
Anybody confused right now? You good?
Because that was our goal. Just kidding.
Let's trick them all into Medicare Advantage now.
And then leave, no, I'm kidding.
And then leave. So this is the handout that you guys all have, and it differentiates in a nice summative way the
Yes.
difference between therapy of motion and home health, okay?
Yes.
So this is with regards to therapy that you receive in the home, or services you receive in the home. Does Medicare cover these services? Yes. We now know therapy in motion is Part B, and home health is Part A, right?
Yep.
Do you have to be homebound to receive care? For therapy in motion, mobile therapy, nope, you do not need to be homebound. Home health, you do have to be homebound, with the exception of, can anybody name one?
Hair care.
Everyone remembers hair. Religious,
Doctor's appointment.
very good. You know what?
Ding, ding, ding.
He gets a chocolate. That you just answered successfully 2 out of 3.
Do you want to see
Trivia.
a copy of his medical degree?
Are you a doctor?
No.
Okay. Oh, you were federal government, I think. Yeah, you're not a doctor.
Well, Dr. Fauci was a doctor.
Oh, you're right, I'm sorry. Do you need a doctor's prescription to see me? No. For home health? Yes. They require what's called a face-to-face, which means you've been to that doctor within the last 30 days who can certify that you are indeed homebound and in need of care.
Yeah.
Do you offer therapy? The answer is yes for both of those, but therapy of motion, we do PT and OT. I don't have a speech therapist that works for me, but I have a speech therapist that works with me that I can refer to as well, okay? And she's also mobile under Part B. Home health, you can get PT, OT, and speech. As long as they have a speech therapist available, they're very rare to
Yeah,
find.
very, very hard to find, yes, very true.
Nursing is not available through a company like me, but is available through home health, and I listed some of the reasons why a nurse would be ordered under there. Bedbound patients, I like nurses in on cases where the patient is bedbound because there's a very high risk of wounds there and a host of other medical conditions. Wound care, medically fragile patients, patients who have recently been discharged from an extended hospital or rehab stay. Typically, it's good to come home with a nurse first, and then they'll discharge, and then we can come in. I have 3 requirements for patients that see us. You cannot be bedbound. You have to be able to independently transfer yourself to the side of the bed and sit there for 10 minutes independently. And you have to be able to tolerate at least 45 to 60 minutes of therapy. And that's not like me having you do calisthenics and jumping jacks. That's just normal therapy activities with breaks in between. Annette can tell you there are many breaks, right? Where we catch up on our families and this is a good question. So if I need a nurse, can I use a home health agency for the nurse, but use therapy and motion for therapy? And the answer is no. You cannot have a home health agency and a mobile therapist in at the same time unless you're self-paying for me, okay? Medicare will not pay for both at the same time. It's one or the other.
Double dipping.
Cannot double dip. And how long can you see me as a patient? I can see mobile therapy, we can see patients for, think more like months. Whereas home health, usually it's a very short window. It's typically about a month or so. So really the point of home health is to get those real acute patients healthy enough that they can then tolerate therapy from me.
I can explain it real quick. So typically it's for high acuity patients that are transitioning home. And you're going from, a lot of times people that are ordered home health, your doctor can order it, but many times it comes ordered from the hospital or skilled nursing facility because you're getting daily care in these settings. And then they want to transition you home with intermittent care. So it'll only be 1, maybe 2 times a week, and for maybe 30 to 60 days. It's in 2 different billing periods, but an episode of care is good for 60 days. But you have to prove that you're either meeting goals and getting back to independence, and then they discharge you. Or if you have plateaued, they will discharge you. If there's no more, as they call it, a skillable need, they will discharge you. Where Kate doesn't have those tight restrictions, and she can be in there for a longer duration to do more with patients.
Correct. Yes?
Okay, I'm in the hospital and I'm about to be discharged. Who decides whether I have to go to a rehab facility versus I get to come home and...
It's a team effort usually between the therapists. They'll do a series of tests to make sure
in
that
the hospital?
in the hospital
Okay.
Yeah.
to make sure that you're safe to go home. Like if you have steps to get in, they're gonna make you do the steps. Making sure that you can transfer in and out of bed, making sure, getting a good feel for your home environment and your home life. Do you have somebody at home that can help you? Do you have people close by? And now all of that information is relayed to the social worker usually, and the 2 of them typically together will come up with the best route for you to take to go home or to not go home.
I'm really concerned. I've never been in that situation. But I'm
Yeah.
really concerned about having to be shoved into.
So this is what I can tell you this because I've gone through it with both my parents. You're gonna, let's say you're in the hospital and they're gonna make the recommendations that Kate just said. So you're gonna have, from a therapy perspective, from a nursing and doctor perspective, they're going to discuss care and the best and setting you up for success, whether it's going to rehab or going home. Let's just say they recommend rehab. they're going to say, pick 3. This is the, like, they're not going to guide you on the benefits of different places to go to get your care. So you're going to want to maybe
But I
work
have
with,
a choice?
patients
Of
always have
facilities?
choice, but it's a choice of things that you know nothing about. That's the challenge. So this is what I'm going to suggest, and I have no sweat in this game at all. I've taken my Ennoble Care hat off. I'm coming from the daughter's perspective because I've been there, and it was disastrous. This is why I got into this business, because I saw what was happening, and honestly, I was really disgusted by it. Make sure, there is a resource, it's called the Source Book. I'm just gonna give you this. This is how I started my business. It's a wealth of information on every skilled nursing facility in every county in Maryland, on almost all assisted living facilities
Is
in
it
all.
online?
You can get it online.
repeat the,
Yeah, it's called the Source Book. Hold on, I have a copy.
Oh my gosh!
I carry it with me everywhere.
You
Kid
are
not.
prepared.
Have you memorized it?
No, and you're gonna see how old it is. This is it. This is like the Bible as far as I'm concerned.
Oh, I've
This
seen
is a
that.
wonderful resource. So when they say, pick 3 facilities that you would like to go to, because they're gonna give you choice. You wanna talk to your family. Here's the first thing. You want people to come visit you a lot because you want people advocating for you, okay? My mom fractured her pelvis and had to go to rehab, okay? So it was during COVID, so we found a facility where they would allow 2 people to come visit every day. So my sister and I rotated. And I got there and my mom was in diapers. My mother was never incontinent, never a day in her life. And I said, Mom, why are you in a diaper? She said, well, they told me to pee in it because they don't have time for me.
Oh, wow.
And so I went up to the director of nursing. I said, get her out of that diaper now. I said, if you don't have help, hire more. That is so, you're just diminishing her spirit. You are creating another problem. Now she's gonna have skin issues and ulcers. It's awful. So I say that, your first thing is you want people there daily so that they can help if you can't advocate for yourself, have people there that can advocate for
Has
you.
that changed since COVID has?
No. Walk into any nursing facility and you are hit in the face with this. No, it's a thing. Yeah, they don't have the staff. Can I answer, did you have a question?
Yeah, it was just, I think it's gotten worse
It has.
since COVID.
And I'm not singling out any nursing facility, that is not my point. My point to you is if you can't advocate for yourself, make sure that the rehab that you choose is close enough so that others can come visit you and help advocate for you. So proximity is good. You wanna look at the star ratings. CMS has a website where they list the star ratings, like if you were going to a hotel. You wanna stay at a 1-star hotel or a 5-star? Everything else is equal, meaning you're paying the same amount.
For all facilities, or?
Yeah, but with insurance is covering it, but then that's a whole other thing. It's under your Medicare B, and there's certain days, like the social worker will explain to you the days that you have, the coverage that you have for skilled nursing. But proximity, star ratings, and some nursing homes specialize in certain things. Like if they might have cardiac rehab or pulmonary rehab, things like that. So just ask those questions.
Thank you.
You're welcome.
So how did that book, sorry.
Yeah, okay, it's loved, so I'm happy.
Source book.
Is that updated yearly?
Yes, and you can go online and have it mailed to you for free.
Is that a county publication or state?
No, it's got all counties in the state of
It's
Maryland.
a nonprofit?
And I think so.
I think I've seen them at the senior.
You can get, a lot of times senior
It's
centers,
called-
sometimes doctor's offices will have them. I just went online and ordered a copy myself.
It's called Positive Aging
Yeah.
Source Book.
I'm getting one.
It's, oh my
You
god,
should
that
be
thing.
honest.
So this is how I helped my parents, cause they were like, pick 3, and I'm like, 3, well, I don't know any, because I wasn't in the industry then.
You should be on the cover, Inga.
I know.
I'm sorry, you had a question.
No, I have a comment. I've been through the process 3 times at Howard County General.
Okay.
With my husband. The first was in COVID. Each time the social worker appears and says rehab. Which type of rehab? Okay, subacute. So I check Medicare, I check the reviews, and I check our secondary.
Good.
Yeah.
I
Perfect.
check all of those.
Yep.
And then, especially during COVID, I said to my husband, who was leaning that way, I said, nobody can visit you.
Right.
How does that sound?
Yeah.
No. Okay. Do you think you can make it at home? Okay. The third time, same deal. And I pushed back because the option was, oh, you get therapy multiple times a day. Multiple times a day is, when you're lucky, 2 30-minute sessions.
That's for skilled nursing.
Yeah, so I can
Acute
drive
rehab's
him.
different. Yeah.
I can drive him to the PT on a daily basis.
Right.
And so the third time, when there was another little issue, then they sent the nurses home to teach me how to flush the IV.
Yep.
I learned that, did that. Everything was
Yeah.
just
Yeah.
fine. So I pushed back. I
Yeah.
wouldn't always push back, but
Mhm.
they come early on in your hospital stay because they want to get this sorted.
Yeah.
They want to know where you're going to go and when.
Mhm.
And fortunately, in each case, especially in the last case, the doctor said, you know, he needs to go home.
Mhm.
He can go home.
Yeah.
I'd give permission for him to go home. So that was the process.
You are an outstanding advocate for your
You,
husband.
yes.
Always.
Good work.
And just so you guys know, that's why we're here today. Like, we work for 2 different companies and we think they're the best companies out there. But we're here to educate you guys on what to look for. You're in a situation where you have to make a split-second decision. Like, I don't know anything about this, so if we can impart anything on you today, it's just to know how to advocate for yourself and to know that, you know, there are resources out there for you so that you can make a well-informed decision.
Yep.
It's really important.
Any other questions? We're gonna do some trivia with a prize plant at the end.
Okay.
Hello, now we got skin in the game.
All right, so
Which of these are covered by United Healthcare?
So that's Medicare Advantage. You would have to call Medicare Advantage your plan and ask what they cover, okay?
the Advantage plans are different than straight Medicare.
I'm gonna ask a
So-
question.
And whoever gets the answer right gets one of
This
these.
is, don't shout out, people. I need to see a hand, and you can
Person
help
with
me
the most
figure
P's
out
at the end.
gets the plan. Are we ready? Question 1. Sally, hopefully there's no Sally in here, okay? Sally was in the hospital for a week and was sent home on oxygen, which is new to her. She has a pressure sore on her heel from lying in bed in the hospital. She is in need of nursing, PT, and OT. Where should the doctor send the referral? A home health agency or mobile therapy? Raise your hand. Oh,
Oh, no.
you got it!
With like,
You guys, he already has 2, I'm just saying. All right, question 2. Gina had a fall and broke her hip. After her surgery, she went to rehab to get stronger. She still needs continued PT for strength and balance and wants to receive this care at home because she can't drive. Home health agency or mobile therapy?
Mobile therapy.
You shout it out. Mobile therapy it is. And that gets a chocolate. All right, raise your hand. Therapy, covered under Part A, is often called, what are those 2 names I kept saying? Yeah?
Home care and home health.
Yes!
good job.
Oh boy, what if there's a tie? You guys are gonna have to arm wrestle. Therapy provided in the home under Part B is also known as, raise your hand.
Mobile.
Yes!
What was it?
Mobile therapy.
You know she's allergic to chocolate.
She's
Oh God, are there any diabetics in the room? Sorry.
True or false, you must be homebound to receive mobile therapy.
False.
False.
Correct. I'm not sure who answered it
I think
first.
you did.
I think you did.
Thanks. You're welcome.
True or false? I have a primary care in my community that I've seen for 20 years. I had a stroke and could no longer drive, but I'm being told that I will regain my ability to drive over time. Can I have a home-based primary care physician for this time?
Yeah.
Last one, true or false? There are hidden fees and travel charges for home-based primary care services.
Oh, false.
I
Let
heard
me
it was a rumble.
You are correct.
I think you should give a limit of 5 to anybody.
However, I do want to point out, there's something called concierge medicine.
Yes.
Just make sure you understand that you pay a fee on a monthly basis to have access to the doctor. It's just a different model than what we do.
So how does that integrate with this?
So if you have a concierge primary care
To
physician,
do?
we're mobile primary, but we're not concierge. We bill to insurance, so we do the same thing though. We just don't charge the fee.
Concierge fee.
You pay the fee for access to the physician.
And unfortunately, that's where healthcare is going, that when you self-pay, you get more attention. We try and provide, the reason I got into mobile therapy is because I was working in an outpatient clinic where I was seeing 20 patients a day, and I just couldn't give anyone the one-on-one attention that I wanted. So this model allows me to be one-on-one with people for an hour and really learn about what I need to help them with. Any other questions at all? Yes?
You alluded to this, but if you have to travel 50 miles to do a speech therapy session, do you somehow get compensated for that?
Nope.
Really?
Nope.
Wow.
We don't, when you're taking Medicare, we're not allowed to travel or charge travel fees.
Right.
Not allowed. So that's why we have territories.
Yeah, you just ask like, am I in your coverage area?
Yeah. And we all have, so my coverage area pretty much is Howard, Therapy and Motion covers Howard County and Frederick County, the whole county. I will go into parts of Montgomery, but if it's an area that I don't cover, I have a slew of partners, referral people, we work together, and I refer to them and they refer to me when it's outside of coverage areas.
And we are in 10 counties in central Maryland.
Yeah, they're huge.
Howard, Baltimore, PG, Anne Arundel, Carroll, Frederick, Washington, Hartford, Baltimore County, and Baltimore City.
They're much bigger.
This is kind of a loaded question, but a lot of medical practices don't accept Medicare Advantage plans.
Mm-hmm.
What's your opinion of Medicare Advantage plans?
Depends.
It depends. I mean, my personal opinion is do your due diligence, because I do think in some scenarios, not all, I'm just saying a broad statement, in certain situations, I do think it can border on predatory.
Mm-hmm.
Yeah. My parents have an Advantage plan and it's fantastic.
There's some that are wonderful.
There's some that are
exactly.
great, and you can't even say, oh yeah, well, Aetna Medicare Advantage is great. No, because within that umbrella, there's 5 different choices maybe, and each one is a little different.
Yes.
We're talking about thousands of different types of plans.
Yeah, you need to find out what's important to you, and does that match what I need? And will it match my needs for the potential future, like the potential big event that could happen?
My
Exactly.
comment is that the system is so complicated.
Yeah.
I can't imagine
It is.
anybody figures it out.
No,
Yeah,
there
it's
are people,
overwhelming.
there are brokers. Oh, who's that person that came to COGS? Remember her? She was like a Medicare broker. There are people that do this for a living, that walk you through it.
Yeah.
And I bet if you just Google Medicare, I actually don't do that. If you have my card, right?
Yes.
It's in there. If anybody ever wants the information on that Medicare broker, just email me, call me, text me, and I'll get the name and phone number of that person. Because she is very helpful and knowledgeable, and it's what she does for a living.
The county does have Maryland Access Point,
Mhm.
where you can call and talk to them about the different plans.
Oh, perfect.
And
Yeah.
help them.
That's a great
figure
resource.
out
Yeah, the
what
Department
might
of
be best.
Aging.
Department of Aging.
Is a great they're through the Department of Aging, right?
Maryland
Yeah.
Access Point.
Okay.
Great resources.
And there's one for every county.
That's awesome,
That's great news.
yeah.